I'm Shauna Bratta, Dr. Mom HD. Thank you once again for joining me. Today we're talking about nocturnal enuresis, or what we most commonly know, bedwetting. So for children, it is a common occurrence. After they've been potty trained, they really still don't have full control of their bladder at nighttime, so sometimes they still need the pull-ups at nighttime. This is common for children up to the ages of 5 to 6. It frequently happens to more boys than it does girls, but it doesn't mean that the girls don't get it, and that it doesn't happen to the girls, because it does. There are things that you need to actually consider before you become concerned about bedwetting. Some of the things that you need to consider are, is this a genetic thing? Is this something that's been in the family where either of the parents have had problems when they were training for nighttime? Did it go till the age of 12 or later? And if it has, were medications involved in it? If that's the case, then sometimes it could be a genetic component. The other thing that you should be checking and making sure of is the fact that is there diabetes in the family? If there isn't a history of nocturnal enuresis or bedwetting past the age of 6 in the family, then look at diabetes. There's a possibility that your child could be having the onset or early onset of juvenile diabetes. Just something to get tested for. The other thing that you can consider is bedwetting can be an emotional thing that happens as well. It can also occur because, well, in this day and age, divorce is prevalent, and sometimes children react, maybe not emotionally, but physically, and physically would be in the way of bedwetting. So these are things that you need to see. So first off, is it genetic? Second off, is there a history of diabetes in the family? Is there something emotional or stressing your child? And then the other thing that you also need to consider is there a urinary tract infection. And sometimes children don't exhibit those, but if you have to sort of ask them, you know, when you're going pee, do you have any stinging sensation? Does it feel like scissors or a cutting sensation? Is there any blood in there? That's what you kind of need to do. You kind of have to be a little bit of an investigator. Now, if nothing like that is happening, and they're still under the age of 6, you really don't have a lot to be worried about. But how can you get your child to train a little bit better? And remember that their bladders are not mature yet. And this is one of the reasons why they don't have that control at nighttime. So, but here's some tips that you can do. One thing, I want you to reduce the amount of fluids that they have at nighttime. Generally, I always tell my patients, try and stop the fluids at about 7 o'clock. If they refuse to go to bed because they need that last sip of water, one sip isn't going to fill up a bladder. So one sip is fine, or just a little gulp, that's fine. They'll be fine. They'll also suck it back when they're brushing their teeth anyway, so if they're thirsty, you might as well give them the water that they require. The other thing that you can do is make sure that they go to the bathroom before they go to bed. Make sure that that's the last thing that they do. Brush teeth, go to the bathroom, into bed, okay, here we go. Read the book, and then you're in bed, it's nighttime. The other thing that you can do is when you say they're having a little bit of a difficult time and you know that they're peeing at the beginning of their sleep, what you can do is you can go in just before you're ready to go to bed. So parents, before you're ready to go to bed, get them to go to the bathroom if you can wake up your children or your child. Me, I could wake up one, but I couldn't wake up the other, so it was a little more difficult. But if there isn't any issues with them waking up, going to the bathroom, whatnot, then that's good. The other thing is make sure that the hallway and bathroom are lit with night lights so that the path to going to the bathroom is easy, and so that when they do wake up, they can get out of bed and not feel scared about it. So those are some simple, basic rules that you can do to follow along and help your child with not wetting the bed at nighttime. And these are things that will be within their realm of possibilities. Whereas the other ones that I mentioned, if it was genetics, urinary tract infection, these are something that you're going to have to do investigative reports on. The other thing that you're going to want to consider, and I've been doing some research on this, and it sounds like some allergists are suggesting that bedwetting is occurring because there's an allergy. It could be to foods, it could be environmental allergies, but the main one that they're looking at is milk products. So consider cutting out milk for about a month and see how that goes, and see if the urination is not being as prevalent during the time that you're cutting out the milk. It could be an allergy, and possibly the bedwetting will stop then. So There's some simple suggestions. Those are ones that I would check out. But just remember that there are medications out there. There are bedwetting alarms that you can use as well. In fact, I would probably try a bedwetting alarm before I would use the medications. And then there's also homeopathy. The medications out there that they have definitely have some side effects, and of course everybody who knows me knows that I love those side effect commercials because I just sit there and say, this makes my job a whole lot easier. Because homeopathy can help, and there are homeopathic remedies out there as long as it's not a major component where things are shutting down within the body. So that is something that you can consider. And once again, thank you for listening, and if you like this, like it on Facebook, follow me on Twitter, and just give me the nod out, thank you very much, on my blog. Thank you. I'm Shauna Bradshaw, Dr. Mom HD, saying once again, ciao for now.